Welcome to our video about type 1 diabetes and mental health. Type 1 diabetes and mental health. Type 1 diabetes is difficult to manage, particularly during adolescence, when young people are dealing with the physical changes of puberty, peer pressure, and stress. New research from Columbia University indicates that poorly controlled diabetes is linked to mental health problems. This has implications for people with type 1 diabetes and their families, as well as their loved ones. Understanding the connection between type 1 diabetes and mental health can help people better manage their condition. Communication is essential in maintaining mental health. It is imperative to keep your emotions in check as you cope with your diabetes. Although insulin can keep blood glucose levels under control, some people may feel that they are alone or depressed. Talking to family members or loved ones about the emotional impact of diabetes can help you feel less alone and more motivated. Here are some ways to communicate with family members and loved ones about your feelings and what you can do to help. It is important to understand that communication can take on many forms, including oral, written, and technology. As a diabetes patient, you may need to pay special attention to your communication style to ensure you get your point across. You can use language to your advantage or use signs of emotional distress to convey your concern. If you're unsure about what to say or do, try using simple terms, such as in the target range. Often, people with diabetes may feel reluctant to share their emotions with others because they do not know how to start a conversation. Similarly, they may not know what to say when someone expresses distress. An open-ended question can help you start a conversation and allow the other person to share their experiences, feelings, and thoughts. This creates an environment that fosters empathy and allows open, honest dialogue. Meditation and deep breathing are essential in maintaining mental health. There are several benefits to meditation and deep breathing. Deep breathing can lower blood pressure by as much as 30 points. Practicing deep breathing on a daily basis will help your body recognize this practice and benefit from its relaxing effects. You should practice this daily to see the best results. But you should not replace other medical treatments with meditation. Meditation and deep breathing can help with mental health in other ways, too. A therapist can offer you valuable insights and suggestions on coping with stress. You can show your doctor these readings and discuss how they affect your overall mental health. A therapist can also provide medical advice and explore techniques that can help control your stress levels. The American Diabetes Association recommends that people with diabetes make an effort to care for their mental health as well as their physical health. In addition, you can look for support groups or a referral directory. You can also discuss your mental health with family members and friends to learn how you can help them. Studies have shown that mindfulness meditation can improve both glycemic control and the quality of life in people with type 1 diabetes. However, there is limited research on meditation's role in this disease, so the researchers have conducted a study to assess how it affects both. The researchers randomized 32 type 1 diabetic adults into two groups, one with mindfulness meditation and one without. The researchers found that meditation significantly improved both glycemic control and stigma associated with type 1 diabetes and mental health. In addition to the mental health complications associated with diabetes, the disease itself carries a high stigma for those with type 1 diabetes. This stigma is exacerbated by the fact that youth with diabetes have lower self-esteem than other children and adolescents. These youth are also more likely to experience poor glycemic control and more acute complications from diabetes than their counterparts. However, it is not clear how much this stigma affects young people who suffer from type 1 diabetes. In addition to affecting the mental health of those with diabetes, the negative perceptions of the disease have been linked to worse health outcomes. Specifically, the stigma associated with diabetes can cause individuals to feel ashamed, angry, or even depressed. This can lead to increased stress levels, which can further complicate the condition. Even when people are aware of the problems associated with the disease, the stigma is likely to prevent them from seeking proper care. In addition to the negative impact of the disease itself, stigma associated with type 1 diabetes can lead to a reduction in the number of people who seek treatment. As such, people with diabetes must be more aware of the stigma associated with it. This stigma can affect patients' self-image and result in a lowered level of self-esteem and reduced physical activity. As such, they should discuss their concerns with their healthcare providers and consider consulting a mental health professional. Proper care will benefit both their physical and mental health. Cognitive decrements. While many studies have examined the relationship between early onset of type 1 diabetes and cognitive decrements, other research has demonstrated that there is no connection. Cognitive changes associated with diabetes develop slowly, and the condition may not manifest in the form of significant cognitive deficits until the person reaches adulthood. However, even mild cognitive impairments may have detrimental effects on daily life. For example, impairment of information processing speeds may affect an individual's performance in complex daily tasks. Although the cause of type 1 diabetes and cognitive decrements has not been determined, several studies have shown that the disease is associated with an increased risk for dementia. In addition to affecting the brain, diabetes is associated with peripheral and macrovascular diseases, such as stroke, neuropathy, and retinopathy. Researchers suspect that cognitive decrements are the result of altered cerebral hemodynamics. A number of researchers believe that the association between diabetes and cognitive decrements is more complicated than first believed. The prevalence of dementia is estimated at 6 to 7% in older adults and is highest in North America and Europe. The number of people with dementia is expected to double over the next 2 decades. In addition, a large veterans registry in the U.S. showed that diabetes was associated with an increased risk of cognitive decline in people aged 65 to 74 years old. A study conducted in Japan found a similar relationship between type 1 diabetes and dementia. Depression. A recent study found that adolescents with type 1 diabetes are nearly twice as likely to suffer from depression. The cause of most of these deaths is suicide. However, adolescents with type 1 diabetes should be screened for depression. According to guidelines, healthcare teams should offer these patients a number of interventions to help them cope with the disease. However, not all children with type 1 diabetes will need treatment. However, screening for depression is a vital part of treatment for any type of diabetes. A comprehensive screening will uncover whether or not your child is suffering from depression. About 15 to 20% of young people with T1D will experience depression. This rate is double that of people without diabetes. Signs of depression include sadness, increased irritability, and decreased energy or desire to do anything. Additionally, the symptoms may impair the patient's ability to sleep, eat, or concentrate. Depression is treatable through medications, lifestyle changes, and collaborative care with mental health professionals. Many of these symptoms are often caused by poor management of diabetes. Diabetes patients who fail to follow proper care can develop other complications such as heart disease, stroke, or nerve damage. It is estimated that up to 50% of people with diabetes have some type of mental illness. If this is the case, it is vital that patients receive the proper treatment and support to overcome these problems. There are many options for treatment, including therapy, medication, and a combination of both. Eating disorders. Women with type 1 diabetes are more likely to display eating disordered behaviors than their counterparts. In fact, women with type 1 diabetes are twice as likely to exhibit disordered eating habits as those without the condition. The most common eating disorder in women with type 1 diabetes is bulimia. Although the exact cause of this association is unknown, the connection between eating disorders and diabetes is not surprising. The disordered eating behaviors that these individuals exhibit can lead to serious health consequences if not treated properly. While there are no reliable screening tools for identifying people with eating disorders in individuals with type 1 diabetes, healthcare providers should be alert for signs of disordered eating. One way to spot disordered eating in a patient with type 1 diabetes is to ask about their eating attitudes, which are their thoughts and feelings about food. Though thoughts about food are a natural part of life, people with diabetes are especially sensitive to the way foods are labeled. These thoughts can lead to feelings of guilt or anxiety. In addition to this, family conflict may be a risk factor. Diabetes-related family conflict and low family meal structure can be factors in developing eating disorders. Furthermore, adolescent girls with type 1 diabetes are more likely to experience eating disorders during adolescence, when the metabolic and hormonal changes that occur are more severe than those in children without the condition. Finally, insulin administration can shift from parent to child during adolescence, which may increase the risk of eating disorders. Thank you for watching. Please like, comment, and subscribe if this was helpful. Stay healthy and let's beat diabetes.